The United States has now reported more than 5 million cases of COVID-19. That is more than any other nation in the world. And that's not the only dire statistic. More than 97,000 children tested positive for the virus in the last 2 weeks of July. That's a 40% increase in child cases in this country. Joining us now is Dr. Dara Kass, Yahoo Medical contributor and Columbia University Associate Professor of Emergency Medicine. Good morning, Dr. Kass. You know, this news about children now contracting the disease at a higher rate comes as schools across the country begin to reopen. What do we know right now about kids, the virus, and how they can catch it and transmit it?
So right now, we still know very, very little definitively about how children contract the virus, how it affects them, and how they transmit it to other people. We're seeing a lot of anecdotal data on opening rates of schools and transmission of virus around camps and other communities. What we're seeing about the increase in the number of cases with children is directly correlated to the unregulated and exponential spread of the virus in states like Florida, Arizona, and Texas. And that's why we're seeing such a huge increase in the number of cases. We're at almost 430,000 children known to be infected with coronavirus, with over 1,000 being in the ICU and 100 passing away. The numbers are just not good.
Dr. Kass, Dr. Fauci out with some comments regarding a potential vaccine that it may not be 100% effective ever. What are your thoughts on that?
I think that Dr. Fauci is right always, but he's really setting up expectations. The FDA has said that they will launch a vaccine that is 50% effective against this coronavirus. We know that we can't expect the vaccine to be a miracle cure. We certainly don't even know when and if it's ready, if people will take the vaccine. So we need to continue to act with public health measures like masking, social distancing, and washing our hands while a vaccine gets up and running. And again, unsure how effective it will be, even when it's ready.
You know, over the weekend, Dr. Kass, we saw thousands of bikers gather in South Dakota for Sturgis, the 80th annual motorcycle rally there. Do you think that we're going to see an impact from that many people gathering in close quarters, albeit it was outside, but still?
Well, it was outside and it was mostly unmasked, and it was bikers from all over the country coming together to an area that is a rural healthcare system for the most part. The doctors of South Dakota were really unhappy about the idea of all these people coming from other states to their community. I hope we don't see a surge in cases, but we've known from a lot of these indoor rallies and other unmasked events that they do have an increased number of cases after the fact.
Doctor, is it safer? How can you distinguish? Is it safer to, I want to go back to the school subject. Is it safer to send college kids back to school or those, let's say, in elementary school?
So it's really unclear. I can say my intel on the ground in colleges, it tells me that college students are not being so good at mask wearing and social distancing once they finally get back to school away from their parents. And so I'm hopeful that the culture of colleges will get them back towards the public health measures. And children, young children especially, do not seem to transmit the virus, we don't think, even if they have high viral loads. So I'm hopeful that younger children can stay in school. We don't have any good data yet on which is better. We're going to try both and see what happens. But I am probably, if I had to take a guess, I'm more bullish on the children than I am the college students.
Right, yeah, because they probably have a little more oversight. I want to get to New York City for a minute, because I believe you're usually in New York City. I don't know if you're there right now, but you know, New York seems to have gotten a handle on this. As we're seeing cases rise in other states, New York is continuing to be below its daily average. Are you concerned that as schools reopen and people sort of get back to business on a more regular basis in the fall, that we can see that second wave? I know New York is quarantining people coming from some of these troubled states. What are your thoughts?
So my thoughts are that I've been waiting for a new wave in New York since we opened up in May, and we haven't seen it. And I think the reason probably is the culture of mask wearing we have here. Everywhere you go in New York, you really see an overwhelming number of people wearing masks and really staying apart, even if they're eating outside at restaurants, walking in the streets, and shopping. And so it's really remarkable to see that we've moved towards a new normal and we seem to be doing well. I can't guarantee that when schools open, we're not going to see an increase in the number of cases, but I'm optimistic that if we do see those cases, because we're doing 70,000 tests a day in New York State and still seeing an under 1% positive rate, we'll find those numbers early, be able to react appropriately, and keep our viral numbers down long term.
Doctor, I caught up with Planet Fitness's CEO last week, and he was telling me they now have 1,400 of their gyms open. Big number, definitely surprised me. And on their new app, they're letting people check capacity before they go. Is it safe to return to the gym? The way I'm thinking about it, we're all breathing heavy, we're touching machines. Doesn't strike me as being particularly safe.
So I would not return to an indoor gym anytime soon. And I certainly wouldn't do it in the states that are allowing indoor gyms, which ironically are the states with the highest viral levels for the most part. New York State still does not allow indoor athletics at all because of the fact that we're trying to keep the virus at bay. I do think that if you are going to go to an indoor gym in an area with a high viral load, checking the capacity of the gym beforehand is a good idea. So is wearing a mask when you work out. But again, I would not encourage indoor gyms at this time, but I can't, at some point, we're going to let people do whatever they're going to do.
Yeah, well said. All right, you heard it there. Dr. Dara Kass, thanks as always. Good to see you.
You too.